Good afternoon, and thank you so much for joining us today to learn about the 25th Annual State of the Air Report. I'm Diana Van Vliet, Director of Nationwide Clean Air Advocacy at the American Lung Association. Today you will hear from myself and Deb Brown, our Chief Mission Officer, Laura Kate Bender, our Assistant Vice President of Nationwide Healthy Air, Natalia Reyes-Becerra, our Manager of Nationwide Clean Air, and Liz Scott, Director of Nationwide Clean Air Advocacy. A note before we start that this presentation will be recorded and the recording link will be circulated afterward to everyone who is registered. This webinar is closed to press. Folks should enter questions into the Q&A box as soon as the questions arise. No need to wait till the end. The chat box has been disabled, so please use the Q&A box to enter questions. And with that, I will turn it over to Deb Brown, Chief Mission Officer for the American Lung Association.
Thank you, Diana. Good afternoon and welcome to the State of the Air 2024 briefing for our partners in the health, environmental, and policy communities. In a moment, you will hear about the report findings and details from my colleagues, but I wanted to start off by saying thank you to all of you for your interest in our report and for your work to make sure everyone has clean air to breathe regardless of their zip code. Without the work of partners like you, we wouldn't see the life-saving improvements in air quality we have seen in the last 25 years that since we have released this report. Just this past year, after many years of research and advocacy, we have seen huge strides. A strengthened standard for particle pollution, a new rule limiting methane from oil and gas industry, stronger limits on pollution from both cars and trucks, and more. Your work matters, and it is making a difference. Thank you for your dedication to protecting public health from air pollution. We are grateful to work alongside of you all in this fight. We still have a lot more work to do, as this year's State of the Air report finds, with climate change posing unprecedented threats to air quality and communities of color still breathing disproportionately polluted air after many, many years. We hope that this report will be a valuable resource for the important work you do. We thank you for joining us on our briefing today, and it is now my pleasure to turn the program over to Laura Kate Bender. Laura Kate.
Thanks so much, Deb. I'm Laura Kate Bender, Assistant Vice President for Nationwide Healthy Air at the American Lung Association, and I really appreciate you all joining us today. So this is our 25th annual edition of State of the Air, an exciting anniversary for us. And I'll note at the top that throughout this year's report, you will notice some callbacks to what the air looked like 25 years ago. As always, the report seeks to put air pollution into everyday language. We focus attention on particle pollution and ozone, and we use two different measures of particulate matter. We give grades to counties for their levels of air pollution. We give grades to counties with monitors, more on that later. So 800 plus counties nationwide. And then we give rankings for metro areas, both the 25 worst, as in most polluted, and cleanest for the different measures of air pollution. And I'll just say at the top that if you take nothing else from today's briefing, well, first off, thank you. And second off, please go to lung.org/SOTA. Dig in. There's a wealth of information in the report. I'll walk through some of it here as well, my colleagues, but we are really eager to have you explore the State of the Air 2024 at lung.org/SOTA. So why do we release this report? Well, of course, for the Lung Association, we care about lung health, and air pollution is a major threat to lung health. This will not be news to anyone in this call, I imagine, but ozone pollution and particulate matter air pollution cause a host of health harms. In terms of lung health harms, they cause immediate shortness of breath, wheezing and coughing, and asthma attacks from short-term exposure. And over the long term, they can damage the lungs, including particulate matter causing lung cancer. In terms of other health impacts, of course, these pollutants cause an array of health harms, everything from making it more likely that folks can suffer from lung infections to heart attacks and strokes, mental health and cognitive impacts, metabolic disorders, and reproductive health impacts. So let's dig into the findings. What did we find in this year's report? Here are some top lines. Overall, the total number of people living with unhealthy levels of air pollution totaled a little bit more than 131 million people. That is more people than last year. We'll talk more about this, but that is because of two big trends. Number one, we are using the updated EPA particulate matter standard for annual PM. And so that captures more people who are breathing unhealthy air. And then my colleague Natalia will also talk about the spikes in particulate matter that we saw in this year's report. We have three measures, as I mentioned. Almost 44 million people live in areas that get 3 failing grades for all three of those measures. We're also continuing, just like we did last year, to see major differences in exposure to unhealthy levels of air pollution. There's a divide between the East and the West that we're continuing to see as wildfires worsen. And there continues to be a divide in terms of the air that people of color versus white people are breathing. One of the things you may know about this report is that we include trend charts when you dig into your local data. Most of those trend charts are still overall downward. And what that means is that the air quality generally has improved since we started putting out State of the Air 25-ish years ago. We know that the Clean Air Act is working. Over its history, this law has dramatically reduced emissions from industry and power plants. We've seen older sources of pollution retire. We've seen our vehicles get cleaner. However, a lot of those trend charts that I mentioned have a big uptick from particulate matter. That's because we continue to see climate change in the form of wildfires begin to outpace the progress that we've been making as a nation under the Clean Air Act. I mentioned that 131 million people figure. That totals out to about nearly 4 in 10 people living in places that have unhealthy levels of air pollution for at least 1 failing grade. And as I mentioned, we are continuing to see disparities in the quality of the air that people are breathing. That disparity comes out to people of color being 2.3 times as likely as white people to live in a county that got all 3 Fs for all 3 of our measures. A couple of other disparity stats. People of color make up about 42% of the overall US population, but 52% of people living with at least 1 failing grade. Now I'm going to hand it over to my colleague Natalia. She is going to dig into the short-term particle pollution measures.
So much, Lori. Particle pollution is continuing to get worse. This year, 65 million people lived in counties that got an F grade for short-term spikes in particle pollution. This is an increase of more than 1 million since last year's State of the Air report, and more people in total than any of the last 13 years of reports. The worst is getting worse. More cities on our 25 most polluted list got worse than got better, and 7 of those cities hit their highest number of days in our reporting ever. Wildfires are not only increasing the number of days and places with unhealthy spikes in particle pollution, they are also increasing the severity of pollution, resulting in the sharp increase seen over the last several reports of the number of days designated as either purple or maroon on the air quality index. These very unhealthy and hazardous days are a serious health threat to everyone living in those areas, and unlike anything we have ever seen in the history of State of the Air. This year, over 32 million people in 58 counties across 10 states experienced purple or maroon days for daily levels of particle pollution. This is an alarming trend that is likely to continue as climate change worsens. In State of the Air, we rank 25 worst metro areas for each pollutant, but since I only have room for the top 10 on these slides, that's what you're looking at. This year, for the first time, only Western states are on the worst 25 list for short-term particle pollution. This is a big change from early years of the report, when historically urban, industrialized, Eastern and Midwestern cities dominated the list. And here I'll hand it back to Laura Kate.
Thanks so much, Natalia. And I will take us to the other 2 measures of air pollution in the report, annual particulate matter and ozone pollution. All right, so year-round particle pollution. You may notice that the overall number here is a huge jump from last year's report. We totaled more than 90.7 million people living in the counties that got a failing grade for this measure of annual particulate matter. And that is because of a good thing, which is that EPA finally strengthened the National Ambient Air Quality Standard for annual particulate matter earlier this year, just in February. This was a major advocacy priority for the Lung Association, for many of you as well. They didn't tighten it as much as we wanted, but they did tighten it. And what that means is that the new National Ambient Air Quality Standard better reflects what the health science shows is safe to breathe. So EPA strengthened that annual standard to 9 micrograms per cubic meter, down from 12. And this, again, is required to be based on the science. And so this better reflects what is safe to breathe. We base our report on that number. So what that means is that we now see more people in more places that are getting a failing grade for this annual measure. Again, it's a large increase, but what we point out here is that these people have probably already been breathing unhealthy air for years, and having the stronger standard now allows us to more accurately convey the risk to people's health from the air they were already breathing. To dig into this a little bit, of the top, in this case, 26 most polluted cities, because we have a tie, more than half of them saw increased year-round levels over last year. 5 places saw their worst levels ever. 7 cities improved, 2 matched their best ever, and Pittsburgh had a new best ever, which is an exciting step. Pittsburgh is perennially on the list of places with unhealthy levels of particles, so it's good to see that milestone this year. And again, here are the top 10 most polluted metro areas. And again, this is the measure for annual particle pollution, so the day in, day out, as opposed to these spikes in particle pollution that Natalia talked through. Unlike the worst places for those short-term spikes, which are all in the West, the worst 25 cities for annual particulate matter are more distributed across the country. Again, although cities in the West with drought and wildfire concerns are still the largest share, you'll see Eastern and Midwestern cities on the most polluted list here, with high power plant emissions, industrial sources, continuing to show up on the list. So in the top 25, there are 6 cities east of the Mississippi that appear on the broader list, including Indianapolis, Detroit, Pittsburgh, Cincinnati, Chicago, and Augusta, Georgia. And then let me move on to a little bit of the good news story on ozone pollution. So ozone was more mixed as opposed to the big jump in annual particle pollution that we saw from the tighter standard, and opposed to those dramatically more severe spikes in short-term particle pollution from wildfires. We have 100.6 million people living in counties with unhealthy levels of ozone. This is fewer than last year, and it's actually the latest of several years of seeing fewer and fewer people living with unhealthy levels of ozone. That said, this is still the most widespread air pollutant that we track, and 100 million people living in counties with unhealthy levels of ozone is obviously still unacceptable from a health perspective. I'll also note that we did see some places in the top 25 get more bad air days on average, or rather, if you average the top 25, they experienced more bad air days. 6 did improve, 2 saw their lowest levels ever. But overall, even though we saw fewer people exposed to ozone pollution, it is a bit of a qualified improvement given the fact that many of those cities did overall get worse this year. Here is the top 10 out of that most polluted list. This is very similar to the top 10 list from last year. Los Angeles tops this list as it has for all but one of the report's 25 editions. This year, the report had a weighted annual average of Los Angeles had a weighted annual average of 175 days with unhealthy ozone, a staggering number. Fresno, although it's at number 4 on this list, recorded its fewest bad ozone days for the 3rd consecutive year. But of course, there are still too many days on which ozone makes the air unhealthy to breathe. Next, I'll go to cleanest cities. So these are in alphabetical order because these are places that are on the cleanest list for all 3 pollutants. To get there, you have to have 0 days with high ozone, 0 days with spikes in particulate matter, and you have to be on the top 25 cleanest list for year-round particulate matter. Many of these have been here before, but new this year to the cleanest list is Johnson City Metro in Tennessee. Now, of course, There are places that are enjoy clean air that are not on this list, but they don't have monitors. As a reminder, we can only grade and rank places with air quality monitors. And if places don't have EPA run regulatory monitors in place to monitor ozone and particulate matter, they are not included in state of the air for those grades. And then one thing I do want to address here is, what about COVID? So this is the first year that all of the years covered in the report were COVID years. As a reminder, this report covers 2020, 2021, and 2022. Those are the three most recent years of quality assured data from EPA. So in the first couple of years of the pandemic, we got lots of questions about how changes in activity levels and traffic affected air quality. I'm sure we all remember the news stories and maybe even our own lived experiences of cleaner air as people stayed off the roads in the early days of the pandemic. It was too early to tell in the last couple of reports. I can say that in this year's State of the Air, there is no lasting gain from COVID reduction measures. There's no lasting significant improvement in air quality that we saw, despite those initial news stories. What we do know, of course, is that there is a long-term that there is a connection between long-term exposure to air pollution and COVID-19 infection and outcomes. There was some emerging research early on that studies have now added to the weight too, that there is an interaction there. And of course, we already know that research has long shown an association between air pollution exposure and an increased risk of illness and death among people who are susceptible to lung infections. So with that, I will quickly remind folks to type your questions as you think of them. We look forward to getting to them. Use the Q&A, and I will now hand it over to Diana to talk a little bit about navigating the website.
Thanks, Laura Kate. Okay, so let's talk about the State of the Air website. Most website visitors want to go directly to the air quality information where they live, understandably, and they can get it in a couple different ways. So just under the top banner on the home page, marked here by a red arrow, you can select your location either by zip code or by state. Clicking on a state gets you information for all the counties in the state that have monitors. And zip code entries will take you right to the appropriate county, whether or not that county has a monitor. If you scroll down on the State of the Air landing page, you will find the different types of report cards we provide, a list of all the cleanest and most polluted cities for each of the 3 pollution measures, as well as state and county report cards. When you get to a state report card, you will see a tab for county ozone grades, a tab for county particle pollution grades, and a tab for populations at risk by county. Please note that only counties with data for pollutants are listed, and we include a note at the top about the number of counties that have data for each of the 2 air pollutants. The grades are color-coded, and the list can be sorted alphabetically by county, by grade, or by weighted average. When you click on the county name, it takes you to that page. Here's a snippet of the grade page for Lake County, Illinois. The 3 grades are shown right up top. You see that for Lake County, there is no data for either short-term or annual particle pollution. The DNC stands for did not collect. If you see INC, that means that we have some data, but not enough for all 3 years to assign a grade. Other options on the county page are to go to the related metro area, which in this case would take you to the Chicago metro page. You can also sign the petition or share your story, options that are offered in multiple places on the website. Many people want to know how this year's results compare with previous years. The best place to get a good picture of the change over time is on the trend charts on both the county and metro area pages, like this one for the annual particle pollution in the Chicago metro area. The metro area is shown as a color-coded, zoomable, scrollable map. This gives you a good idea of what we call a city. These metropolitan statistical areas can cover a large area with many counties. The bright blue line on the trend chart shows the weighted average for this pollutant for every 3-year period since reporting began. The dark blue line represents the current threshold for meeting the national standard. In most cases, you can see the downward trend in air pollution over time thanks to the Clean Air Act. Excuse me. There's a lot of other good information in the report too. So the key findings section covers the highlights that Laura, Kate, and Natalia shared with you today. But the health impacts of the air pollution section provides the evidence base for why we do what we do. It includes up-to-date research findings on the health effects of particle pollution and ozone, and an explanation of which groups face increased risk from air pollution and why. Liz will go over the recommendations for action section in a little bit. But before we get to Liz, I will quickly cover where this data comes from. The first step is that states collect air quality data from air quality monitors. The data for this year's report was collected in 2020, 2021, and 2022, and are the latest quality assured data available. EPA then reviews this data and posts it online, where our consultants download and prepare it for us. We use this data to calculate unhealthy days, weighted average, design values, grades, and rankings. Ozone and daily PM letter grades are derived from the number of days a county or city had unhealthy air quality levels based on the air quality index, which is the orange, red, purple, and maroon scale that you're familiar with. Days at worse levels, such as purple or maroon, count for more than days at lower levels, such as orange. Annual PM is a little different and uses a pass-fail grade based on whether a county or city is above or below EPA's National Ambient Air Quality Standard. We are often asked why counties don't have a grade, and there are a couple of possible reasons. The first is that only about a third of US counties have any monitors of any type, or any EPA monitors of any type, meaning 2/3 of the counties won't have data. Additionally, counties may not have both PM and ozone monitors. We rank cities separately for the 3 different pollutants: short-term particles, year-round particles, and ozone. Cities often have more than one county, and the ranking, and this is important, the rankings are based on the most polluted county within a city. We follow the Federal Office of Management and Budget, or OMB's, definition of cities, which include metropolitan statistical areas and combined metropolitan statistical areas, which may include multiple cities, such as LA, Long Beach, and Anaheim. These metro areas are based on a number of factors, including geography, economic ties, and commuting patterns. I will now turn it over to Liz Scott.
Thanks, Diana. With every challenge comes an opportunity, and State of the Air continues to show that we have an inequitable air pollution challenge, but we have an opportunity to fix it. State of the Air always includes a call to action. You will see the Take Action button throughout the online report. This year's call to action is directed at EPA, urging the agency to set long overdue stronger national limits on ozone pollution. Stronger limits would help people protect themselves and drive cleanup of polluting sources across the country. Unfortunately, EPA kicked the can down the road on this, announcing last year that they were going to go back to the drawing board, which could add years of delay to what, well, we hope will be stronger ozone limits. EPA also recently announced they're beginning the process of a workshop to discuss the science on ozone. The law requires EPA to finish this ozone review by December 31st, 2025. So we need your help to urge them to move efficiently through this process. The report also includes a section titled Recommendations for Action. This section includes actions targeted at the federal government, local, state, territorial, and tribal governments, as well as individuals. Last year, we had a long list of clean air and climate rules that we wanted EPA to finalize. The great news is that most of them are now across the finish line. So far, EPA has finalized the stronger annual PM standard, which again is reflected in this year's data. They set methane limits on the oil and gas industry and set new, stronger clean cars and truck standards. All of this is on top of the passage of the Inflation Reduction Act in 2022, and we are continuing to see investments in clean transportation, zero emission appliance, and clean electricity roll out thanks to that law. So a lot has happened in the past year, and just want to add a quick second of thank you to all of you, your organizations and advocates, for helping us get to the point where we can have the words done next to a long list of actions. But as always, there's more that the federal government can do to more fully protect health. We need to see those national standards for ozone. And we also need to see the final rules to clean up mercury and carbon pollution from power plants. We also know that all of the things that have been completed in the past 6-ish months from EPA will be under threat by industry voices and their supporters. So we are calling on Congress to defend the Clean Air Act against attempts to weaken Clean Air Act standards, and also to adequately fund EPA to do the critical work of reducing emissions and protecting health. For state, territorial, and tribal governments, the main asks are to implement all of these new clean air protections, leverage the Inflation Reduction Act funding, and prioritize the deployment of clean energy production. We would also hope to see areas set clean or renewable electricity standards. And lastly, we also continue to urge states to adopt California's stronger emission standards for zero emission cars and trucks. There are things that local governments can do, such as adopting local climate action plans that make sense for their jurisdictions. They can purchase zero emission vehicles for their official fleets and commit to purchase more of their electricity from renewable non-combustion sources. And while we can't see progress without that macro level policy and changes, individuals do have a responsibility to play in protecting their own health from air pollution. First and foremost, everyone should make checking the air quality on airnow.gov part of their morning routine, just as you might check the weather to determine what to wear and what to do for the day. You can reduce your own contributions to air pollution by prioritizing walking to places whenever it's possible and safe to do so, or bike or take clean public transit. Conserve as much electricity as you can, and don't burn things like trash, leaves, or wood. There are also a ton of tax incentives that are live and available for you to take advantage of that will reduce emissions from your home and your vehicle, cleaning up pollution and protecting your health at the same time. And then show up at the local level. In addition to taking action with the Lung Association, you can advocate for air quality and climate policy change in your community. Get engaged with your local policymakers and civic organizations. Learn more about what opportunities exist for local advocacy, such as showing up at public hearings or meeting with those local leaders. So how do we want or hope that you'll use State of the Air? Please share the results in your own advocacy activities. We really love seeing State of the Air stats pop up in reports and messaging and tweets and things that we see throughout the year. Share the petition for stronger ozone standards. If you want a printable version of it, please let us know. Share the recommendations for action with leaders and pair State of the Air stats with communication with decision makers. We also love a good use of social media. We have been sharing some sample social media posts, so if you would like those, please reach out to us. And then, of course, we always love feedback on how this report can be even more useful for you. So to elaborate a little bit more on future projects, I will hand it back over to Diana.
Well, we are actually at the Q&A section. So thank you so much for Liz, for that, Liz. And I will invite my Lung Association colleagues to turn on their cameras if they'd like. And I would invite and remind all of you to use the Q&A box if you have any questions that you would like to have answered. And thanks to those who've already entered some great questions. So I'm just going to read them out and invite my colleagues to answer. So first question, does the State of the Air report include any metrics or algorithms for places, which are usually in the Western US, where meteorological conditions are more conducive to high PM 2.5 and high ozone levels? These conditions include low level temperature inversions and stable air with higher occurrence, more so than the East Coast areas. It's a great question.
I can start. Welcome other folks jumping in, and thanks for the question. So the short answer is no. We are just looking at air pollution levels as they are monitored by the monitoring network across the country. But of course, the results reflect the meteorological conditions that you're flagging. That in some places we're obviously seeing, ozone inversion or inversions that lead to ozone, high PM due to wildfire smoke. I think the thing I'll add here that we always like to emphasize is that we are assigning a letter grade to the air quality, not to the local effort to clean it up. So number one, we know that a lot of communities have made enormous strides. We always point to California. California's air pollution challenges are well known, but they're also often at the forefront of policy work to address them. And the air is generally a lot cleaner, particularly with ozone, than it used to be. So the grades are not a reflection on the great work that air quality industry folks across the country are doing. And then I'll also note one other point, which is that our methodology is different from how the Environmental Protection Agency determines whether communities are meeting the National Ambient Air Quality Standards. So as a quick example, EPA allows states to seek exemptions for days when wildfire smoke makes air pollution levels violate those standards. We include those days in our report because we are looking at what people's lungs are facing, and your lungs don't care whether something is designated as an exceptional event in EPA's process or not. So we are inclusive. We include those days when air pollution violates the levels of the national standards, regardless of where those levels are coming from.
Thank you so much, Laura Kate. There are so many great questions. It's hard to choose. I'll just go to the first one I'm seeing. Is there a comparison of county air pollution levels to WHO standards of unhealthy levels?
That's a great question. No, we use EPA's. So we're happy to dig into the methodology further if it's helpful, but we use EPA's National Ambient Air Quality Standards as the basis for our grades. I will note that the World Health Organization does have different standards. We're happy to share more offline, but we're just looking at EPA's in this report because that's the official US-based metrics that we're grading to. But I should note here that we are perennially pushing for stronger EPA protections for ozone, as in our policy ask. We wanted stronger than we got for annual particulate matter, and we wanted updates to 24-hour particulate matter too from EPA because the health science is so clear that those pollutants are so harmful.
Thanks, Laura Kate. Which air quality monitoring networks do you rely on for your data?
I don't mean to hog all the answers. Folks are welcome to jump in. So we use EPA's regulatory monitors. So essentially, these are the monitors that EPA funds and works with states, tribes, and other entities to deploy across the country to monitor levels of ambient ozone and particulate matter and determine whether those communities are meeting the National Ambient Air Quality Standards. And I'll note too that this monitoring network is designed to capture air pollution over an area, the ambient air. That means that it's not always going to pick up everything. For example, we know that you may have very block-to-block differences in air pollution depending on how close you are to a polluting source. And of course, there are a lot of places that don't have air quality monitors, but the network that we're using is set by EPA.
Thank you. Are increased dust storms from climate change also contributing to poor air quality in the West?
You can start and welcome other folks' thoughts here. So I'd say we are not looking at coarse particulate matter. We're only looking at PM 2.5 fine particle pollution. I imagine that dust storms would sooner show up in readings of PM 10 than PM 2.5. But I will say that the conditions that are leading to more dust storms are certainly also contributing to air quality issues through drought, wildfire conditions, et cetera, in the West. I welcome other thoughts there too.
I'll also add just a general point on state of the air. We don't attribute to particular sources, as Laura Kate mentioned. So there wouldn't be like a breakdown of which source is contributing to an area's air pollution problem. We just look at the data of what the air pollution problem is.
Do we have previous year's results up on our website so that folks can track trends, across states and counties?
You sure do. Yes. So number one, the trend charts have all the previous data. As Diana walked through, if you see a gap in the trend chart for a given area. It is because data were not collected in that year, but otherwise, if data was collected, they should show up in the trend charts. And then also, if you really go digging on the website, you can access the previous State of the Air report PDFs all the way back to the original.
Great question. Thanks. Is there any consideration of air quality and heat together? And does this show up in the report?
Not in the results themselves, but I will note that more heat tends to mean more ozone pollution. So part of the reason that we see variability year to year in ozone levels is obviously sources of emissions that contribute to ozone pollution change over time, hopefully for the better as we all implement cleaner air protections. But also weather is a big factor in ozone. And so a hotter year might produce higher levels of ozone pollution. I will say from a public health perspective, Lung has lots of information and can pass along lots of resources on protecting health, for example, people with asthma in the context of heat and air quality. And we're happy to follow up with that if it's helpful.
Yes, that was a great question from Heidi. Thank you. How do we account for a county like Lancaster, Pennsylvania that has a B for ozone, but a failing grade for both PM measures?
Thanks, Brian, for the question. So I can follow up with more specifics about given locations if it's helpful. We're always happy to do that. Generally speaking, I'll say, number one, while there is lots of overlap in sources of these pollutants, some sources contribute more to one or the other. So for example, generally speaking, wood heaters are going to lead to higher particle pollution levels, and ozone is heavily influenced by temperature. I can share over some specifics, and I will also note, because this is a good moment to note, that in addition to the resources on the report website and the report PDF, which is available for download at the website, we also have press releases for not only nationwide, but communities across the country. And those dig in even a bit further to the specific results for larger metro areas. We are happy to share any of these resources if you have trouble finding them as you dig in, and we can always follow up.
I'll just piggyback on that with another county-specific question. So Travis County, Texas gets a grade of B for particle pollution, but in the grade for annual PM, it shows fail. Can you explain the difference?
Yes, thanks, Luke. So this is the difference between the 24-hour spikes in particle pollution and the annual year-round standard in particle pollution. So two measures. In this case, Travis County gets a B grade for spikes. So it's doing pretty well in terms of not experiencing days with unhealthy spikes. But the annual average level of PM is still violating the new annual standard. And that means that because this pollutant is dangerous, both in short-term spikes and for longer-term lower levels of exposure, that it's still creating unhealthy air conditions.
Thank you. What are the air quality factors that we are most concerned with associated with natural gas plants and storage sites?
Lots. I'll flag a couple here. So when it comes to the extraction, processing, distribution of gas, as it shows up in this report, one of the big concerns is emissions of volatile organic compounds. So we know that extracting and processing gas results in leaks and emissions. One such example is volatile organic compounds. They're dangerous for health on their own, but they can also react to form ozone pollution. And then similarly, burning gas in a power plant produces emissions of oxides of nitrogen. Again, these are dangerous pollutants on their own. There's lots of information about NOx, as it's called, on our website, but they also react to form ozone pollution. Ozone is not emitted directly from anywhere. Instead, it's formed from reactions in the atmosphere of other what are called precursor pollutants. And these are both major sources of those precursors.
Thanks, Laura Kate. And just last call for questions. I'm not seeing any more, so please enter any additional questions you have in the Q&A box now. And while we give it a minute, I guess I'll just say to anyone on any of the speakers, any final points you want to make on this year's State of the Air report?
Sure. Thanks so much again, everybody. You do still have time to keep asking questions, but I think what Diana has shared, and what I think the last few years that we've done this are that, the greatest value of the report for us is making it useful for everyone in our collective goals to secure stronger air quality measures and address climate change. And so we really genuinely do love your feedback and suggestions. As on the requests. Can folks still hear me?
You broke up a little for me. Hopefully it wasn't me.
Okay, sorry about that. I was, apologies. I was just saying, we are always happy to consider requests for short-term ways the report could be more useful, stats or number crunching or resources. And then in the long term, we genuinely do, we know this report does not answer every air quality question. And so hearing what you wish it covered is always helpful to us. Can't promise we'll include it in the future, but we can certainly always consider it and see how we might be able to provide additional resources.
Thanks, Laura Kate. I'm seeing one more question, which is really interesting. Are there relatable monitors for school playfields? Synthetic turf fields at schools and communities everywhere now. They have 40,000 tires in pulverized form and much more, which is really concerning given the plastic material degrades into PM 2.5. Can you suggest a monitoring device that you trust?
Thanks for the question. That is alarming. So the shorter answer is no, we don't typically endorse products. And I know there are hundreds of low-cost sensors out there, I should say, starting at low cost, going up to higher costs, for how folks are doing their own community air monitoring projects. So we can't share a lung endorsed answer to your question, particularly knowing that, I think most of the ones that I've dug into are either looking at fine particulates or ozone, and I'm not sure about toxic monitoring. But I can pass along the California Air Resources Board's testing of a variety of different sensors to see if that gives a helpful starting point. Please do reach out here to the contacts on the slide or make sure that we have your information so we can follow up with you.
Yeah, thank you for flagging that. I had never thought about that. And one other question I'm seeing about the easiest way to compare cities' ranking over multiple years. And just a reminder, we have trend charts. And if you're interested in seeing previous State of the Year reports, we also have downloadable PDFs. Anything to add?
Thanks for the question. Yeah, and I'll add to the press releases. We also typically do highlight differences. So start with the trend charts, but then also take a look in the media section of our site for your local press release, because that often digs in. And if you still have questions or want more, we are happy to talk about this further.
Thank you all for the great questions. And just to reiterate, if you have another question pop up that you didn't think of, please feel free to reach out. We are happy to talk more about this. And we are just so grateful that you are interested in this report. We really hope you find it useful and valuable in your important work too. And we will have this recording circulated in case you'd like to revisit it or share it around. So thank you again for your time. Thanks, everyone.